The femur is the only bone in the thigh and the longest bone in the body. It acts as the site of origin and attachment of many muscles and ligaments, and can be divided into three parts: proximal, shaft and distal. In this video, we shall look at the anatomy of the femur, its attachments, bony landmarks, and clinical correlations. Proximal. The proximal aspect of the femur articulates with the acetabulum of the pelvis to form the hip joint. It consists of a head and neck, and two bony processes, the greater and lesser trochanters. There are also two bony ridges connecting the two trochanters, the intertrochanteric line anteriorly and the trochanteric crest posteriorly. The shaft of the femur descends in a slight medial direction. This brings the knees closer to the body's center of gravity, increasing stability. On the posterior surface of the femoral shaft, there are roughened ridges of bone, called the linea aspera. This splits distally to form the medial and lateral supracondylar lines. The flat popliteal surface lies between them. Proximally, the medial border of the linea aspera becomes the pectineal line. The lateral border becomes the gluteal tuberosity, where the gluteus maximus attaches. Distally, the linea aspera widens and forms the floor of the popliteal fossa. The medial and lateral borders form the medial and lateral supracondylar lines. The medial supracondylar line ends at the adductor tubercle, where the adductor magnus attaches. The distal end of the femur is characterized by the presence of the medial and lateral condyles, which articulate with the tibia and patella to form the knee joint. The femur is mostly fractured at the neck of femur, intertrochanteric region, its shaft, supracondylar region and condylar region. Fracture of the femur may lead to the avascular necrosis of femoral head because of the damage to blood vessels. Femoral fracture may also cause damage to the sciatic nerve that may lead to severe problems. To determine whether a femur is right or left, you must check these points. 1. The head faces toward the upper and medial side. 2. The linea aspera is posterior. 3. Lesser trochanter is posteromedial. 4. Distal condyles face downward, with intercondylar fossa posteriorly. If you stick to these points, you must know the right answer to this question. Answer in the comment section.